Hello and welcome to Nursing Webinar Series. Myself Shanti, and today's topic for discussion is all about the patient surgical safety and real-time capture of checklist. For this discussion, we are honored to welcome our two experts. Let me introduce about our first expert, who is none other Dr. Vishnu Reddy Garu, who is our Vice President for Medical Services from Yashoda Hospitals. I
Good
welcome you, sir.
afternoon. Good afternoon, Shakti. Good afternoon to the whole team
Good afternoon, sir.
and everybody who's logged into the webinar. Thank you so much for the introduction. Thank you.
Thank you, sir. And let me also introduce our second expert, Dr. Vinay Garu, who is HOD anesthesia and pain physician from Yashoda Hospital, Somajiguda. Yes, Dr. Vinay, I welcome you.
Thank you, Shantiji, and welcome to the entire team. I hope we will have a great session.
Thank you, sir. And let me also introduce our beloved speaker. I think firstly we'll start with Shabina. Shabina, you would like to say something? Yes, over to you.
Yes, very good afternoon to one and all. So, my name is Shabina P. Gopi. I'm a professor in Indira Gandhi Group of Institutions, Bangalore, and I'm very privileged to have you all here for a webinar. And I'm so happy to associate with Yashoda Hospitals because the majority of my students are working there with discipline and care.
Yes, thank you for this such a warm, insight about the same. And let me also welcome Miss Aditi, who is our nursing coordinator from High Tech unit, and Jyoti from Secunderabad unit, and Meme, who is our the very fresher nurse from Vascular OT. Yes, we welcome you, girls here. Yes. So let me start with the discussion first. Like, yes, we are going to talk about surgical safety, and we all are aware that 1 in every 10 patients are harmed as per WHO data. Yes. So the first insight we like to understand from Dr. Vishnu Garu. Yes. Why do you think this modified surgical safety checklist at in our setup and everywhere should be checked and validated every day? Yes, sir. Over to you for your insight. Yes.
So good afternoon again to all the panelists as well as the people who are listening, all the nurses and everybody else who's listening on the webinar. So Ms. Shanti has posted a very important question. Why do we have to do this checklist in the operating theater? It is, of course, the checklist is not specifically meant for operation theater, but a checklist has to be there everywhere. Primarily, this is to prevent any complications and any, errors, especially, very major errors like wrong identification of a patient. And I'm sure all of us understand that when a patient comes into the operation theater, the patients are very emotionally very upset, and then they're very, very tense, and they're not able to. And then once we anesthetize the patient, it is our responsibility to know whether we are operating on the correct patient first and foremost. So we have to identify the patient properly. As per the IPSG goals also world over, we have to, the first goal is to identify the correct patient. So that is the first and foremost thing we need to do. And whenever we have to operate, obviously we need to take the consent of the patient. So we have to ensure that the consent is properly taken and the doctors have explained to the patient what is being done. And the third important thing again is whether the correct side and the site of surgery is being identified, and whether we are operating on the correct side and site. So these things are very, very essential. Apart from this, of course, we need to identify whether the patient has any allergies so that we prevent giving a drug which the patient is allergic to. So that is one more important thing that we need to track. And the other important thing that we need to track is whether the patient identify allergies and site we have identified, the identity of the patient, and of course the allergies. And the important thing is whether all the team members are present or not. So these are very important before we take the patient into the operation theater. This is basically to prevent somebody operating on the wrong patient in the first place and on the wrong side or wrong side. Now, if you take examples, have we done this before? It has happened all over the world. So this is the surgical safety checklist is primarily, again, there are few goals. One is to enhance the patient safety. Okay, very, very important. Second is it promotes team communication. The whole team should be present when we are identifying and, acknowledging that this is the correct site and the correct patient we have taken. This obviously reduces surgical complications, and more importantly, this particular safety checklist of WHO standardizes the practices across the world. So even if you
Yes.
learn here in India and then you want to go and practice elsewhere in the world, the same surgical safety checklist is practiced. So this is a standard practice globally. Okay, so that is very,
Yes.
very important to understand. This obviously brings in a culture of safety, and more importantly, there are three phases, of course, which will be discussed
Further.
along the course of
Yes.
the seminar. One is the sign in, the timeout, and the sign out, which I think Shanti and the team will be taking it forward. Thank
Yes.
you.
So yeah, furthermore, we will be heading with this session, and thank you for your very great opening insight, sir. And yes, we also like to understand from Dr. Vinay, like as we take a lot of accountability and ownership we need to take. So who are the leaders in surgical team, and who should take accountability for patient safety? Yes, sir. Dr. Vinay, over to
It's,
you.
I would say it's more of a team effort. Okay,
Yes.
so like, it's not like this. This is my job. This is your job. It doesn't work out like that. So WHO safety checklist. It comes each and every guideline, each and every part of the checklist has been learned the hard way. So there are
Yes.
guidelines have been made based upon past experiences. So where like patients did lose their lives. So that is the reason
Yes.
why there is a checklist in place, and everyone, including the surgeon, the anesthesiologist, the nurses, the anesthesia technicians, and the OT technicians, everyone
Yes.
should take responsibility to be a part of the WHO safety checklist, which consists of three parts, which we'll be discussing in much detail. But everyone
Yes.
should take active participation. Everyone should be aware of what is happening. And
Yes.
every patient is important for us. So every new patient, the checklist should be done again. Each and every detail should be accounted for by all members of the team, OT team.
Yes.
That's what I
So
feel.
yes,
So
very rightly you said that the patient safety is accountability is everyone's job. Yes. Furthermore, going ahead, like what actually does the term accountability mean in healthcare? Yes, Aditi, you would like to say about this slide? Yes.
Thank you so much, ma'am, for the opportunity. I would say accountability is owning the thing as mine. Like I'm doing the right thing to the right patient at the right time is what I mean as accountability. And for
Yes.
example, if I talk about an accountability for my sign out procedure, I,
Mm.
being the circulatory nurse, should be accountable to make sure all the team members in the theater are present, like the anesthetist, the nurse, and the surgeon, to make sure that I am doing the correct gauze, mop, needle, or the scalpel count to make sure the patient is in a safer zone and maintain the quality of the hospital as well.
Yes. Yeah, as you rightly said, the accountability and ownership should be taken to prevent patient harm. Yes. Now, we do have sets of pre-operative checklist and surgical safety checklist in our setup and everywhere across. Yes. So this, insight we like to understand from Meme. Yeah, Meme. Like what pre-operative check challenges commonly you face when you receive a patient from ward or ICU or, direct admission to recovery, or in general, what you experienced so far? Would you like to tell us? Yes.
Thank you so much for the question. Ma'am, the thing is like day to day, like every day we have faced like new challenges. Like most of the time what happened, the thing is like patient incomplete identification. Under
Yes.
that, we see like some patient lost their ID band and mismatch
Yes.
of the IP number and the age. All those things are we see. And sometimes because of the rustiness, we see like there is no consent sign, like consent of surgery, consent of anesthesia, we see. Or sometimes so like we sister as a human being we did mistake. Sometimes we forgot to like maintain the medication history of the allergies of the patient, and whatever patient is
Yes.
taking medicines, we forgot to maintain all those things. Or like sometimes what happen if patient is having surgery today and patient is not NBM, so all those
Yes.
things are we are facing day to day life, and like while receiving the patient from pre-op to recovery or at the anywhere.
Yes. So what do you do if in case, critical lab alert is not informed to the consultant? Like there was a hyperkalemia, like the potassium was 6.2, and you see during handover, this result is not escalated to the consultant. And being as a handover nurse, what action did you take? Do you take to just overcome this issue? Yes. Over to you.
Okay. For my side too, like we have to consult anesthesia first of all, and after that, whatever consultant anesthesia consultant will see, we have to do all those things with that only.
Yes, yes. So let us also hear from Shabina, who is from Bangalore, and their students goes to Tri-Life Hospital, which is again 600 to 800 bedded multi-speciality. Yes, Shabina, what happens at your setup? In your setup, how do you train your nurses in terms of taking care of this pre-operative checklist and whenever they receive the patient in recovery? Yes, over to you, Shabina.
Thank you for the most relevant question, Ms. Shanti. And I'm so happy to explain you about this because our protocol is different. Like we have, as what you told, we have 600 bedded hospital, NABH accredited, and it is a parent hospital. And regularly we
Yes,
post our students there. And as a part of third sem curriculum of BSc Nursing under RGUHS, we have OT as a strict requirement. So after completion of our theory parts, we will be posting the students to the different OTs, the minor
yes,
OT as well as the major OTs there. So on the first day of their posting, we'll be going directly giving a hand-on exposure right from the
yes,
orientation until to assist the surgeries in turn. Actually
yes,
speaking, our correlation or we collaborate with the OT in charges there, and we will be managing accordingly in order to learn the different aspects of OT procedures. And here, the checklist, a safety checklist, I have to explain it more because usually we will be going there explaining them how to maintain, what is the importance to maintain the safety checklist before any
yes,
surgery procedure with, and what is sign in, time out, and sign out also. So it's yeah, it's quite
yes.
important for us too.
Yes, as you rightly said that, compliance to the students' training, whenever they are, supervised, they learn all these, checklists and beautifully when they become registered nurse, they are able to do well. Yes. Going forward, now the main webinar content which we are going to talk is real-time capture of surgical checklist. As everybody spoke till now that, everything is every hospital, everything is expected to be done in a right way, right? Things on all patients all the time. That's how we are supposed to do. So we have streamlined few process in our setup, how we should monitor real time capture should be done, and validations and multiple escalations to the team anesthesia head and management head to be escalated to. Yes, let us see, like, now this insight which we would like to understand from Dr. Vinay, like, we have set up these process, and with your help and all, what is the process where we do real time and monitor and each parameter in our setup, like we have sign in, time out, and sign out? Yes, for this parameter, what is your intake on the same, sir?
Okay, thank you. Thank you once again. So the WHO's safety, WHO surgical safety checklist consists of three parts. One is
Yes,
sign in. This is done just before induction of anesthesia. The
yes,
other one is time out. This is done just before skin incision. And the third one
yes,
is sign out. This is done just before the patient leaves the operating room.
leaves you. Yeah,
So sign in, the anesthesiologist plays an extremely active role because he, in coordination with the staff concerned, will check if the patient, as first of all, we have wheeled in the right patient or not. Because most of the
yes,
times it has happened in the past, before the WHO safety checklist was implemented properly, we did wheel
yes,
in the wrong patient. And
yes,
when we wheeled in the right patient, the site was marked wrong. Either the site was
yes,
not it or not, either the operating site was not marked or it was marked on the opposite side. And
yes,
unfortunately, we had previous instances like the patients being operated on the wrong side. So
yes,
fortunately, once this safety checklist have been applied properly,
yes,
we almost had zero instances.
yes,
So
yes,
actually, this system works. This
yes,
enhances the patient safety to tremendously. Okay.
yes,
Then
yes,
we also need to identify the proper procedure and whether the consents have been taken properly or not. Okay.
yes,
Then
yes,
for certain surgeries, site marking will not be
marking.
applicable. But then even then you need to mention site mark not applicable, so that the entire team knows what the actual surgery is. So
Yes.
there will be, so that is the reason why we have many cross checks.
Yes.
So the more the number of cross checks, the more will be the safety of the patient. Then
Yes.
from anesthesia point of view, I also need to know if the patient has any allergies, because no one administers more number of drugs in a short span of time as an anesthesiologist.
Yes.
So we are the ones who should be maximum concerned about the potential allergies in a individual patient. So that's the first one we rule out. Then of course, difficult airway, we have to be prepared. That's our job. And then if whenever there is a risk of more than 500 ml of blood loss, we also need to check the hemoglobin to make sure if blood and blood products are readily available in the blood bank or not. Okay, so because
Yes.
in previously we had instances where the patient was anemic, we knew ahead that like the possibility of blood loss was more than a liter, but we couldn't arrange blood on time, and
Yes.
that's
Yes.
why the patients like were subjected
Yes.
to risk. But not our, now everything has changed because of these
Yes.
guidelines. We know which patient we need to transfuse, and blood is always ready in the theater even before skin incision is made.
Yes.
So all these steps, all these checklists have greatly enhanced the safety of our patients. So today I can
Yes.
confidently say our patients are a lot safer inside the operating room.
Yes, yes. And we take great privilege to even announce that yes, we our patients are safe in our setup. Yes. Going forward, that is the reason that we were discussing before this webinar. We require a lot of surgical champions. Yes, Jyoti is one more surgical champion. I see her going to Secunderabad and doing a lot of audits and monitoring about the this surgeries and all. Yes. So, Jyoti, do you face any challenges when you capture this sign in? Like, as Dr. Vinay said rightly, sometimes, everything should be documented, should be called upon, should be debriefed. Yes. Do you face any challenges? Like, you are the best person who can tell us. Yes, sometimes signature is there, sometimes, tick is present, but then it is not documented. Yes. Over to you.
Yes, ma'am. Thank you, ma'am. And mostly I was in sign in before induction of the anesthesia and circulatory nurse to ask the patient. And after that,
Yes.
site marking and mostly I was in challenges like no, allergics, ma'am, main
Yes.
in the sign in
Yes.
part. So
Yes.
sometimes they mark it in the PAC, ma'am. So then sometimes they will not marking in the sign in.
Yes.
That is the
Yes.
main, ma'am. And after that, sometimes verbally they have done, but after that they will not document it, ma'am. Verbally
Yes.
they'll do it.
Yes.
And
So we
most,
urge all our viewers and nurses, especially the OT nurses and pre and peri nurses, that any allergies, anytime, please cross verify, document, check with your doctors, check with your patients, and then let your patient wheel in. Yes. Going forward, again, yeah, this is again for Vishnu sir's insight. I know these, process requires administrative support as well. So, we like to ask Vishnu sir's insight on what are the few top tips for nurses and healthcare professionals you would like to give to overcome this timeout challenges in OT. Sir, yes, because timeout is, timeout is little challengeable, what I get to hear and what we get to witness as well. Because,
Yes, Shanti.
yeah,
Yes,
yes.
Shanti, I
So,
think you hit the nail on the head. Timeout is one of the most challenging things in the entire surgical safety checklist. Primarily, I would say this is because the surgeons are involved in this. The
yes,
surgeons have to be present during the timeout. As long as we tell the nurses to do something, let me tell everybody that maybe 99% compliance will be there from the nurses. 1% still not there, so that we have to do.
thank
But when it
you.
comes to the
Yes, you're right.
surgeons, it's almost the reverse. The surgeons feel that everything should be done by somebody else. But ultimately, as a team, all of us are responsible. Dr. Vinay and everybody is saying
Yes,
it's a team approach. So timeout, one of the most important things I said is the whole team should be present and all of them should identify themselves, the surgeon, the nurse, the scrub nurse and the circulating nurse, as well as the technician, the anesthesiologist. So the whole team is present. So first and foremost, they should be present at the time of after the induction, before the incision, the patient is draped, and then before the incision, again, we confirm whether it's the correct patient we are operating. So even
yes,
if by any chance a mistake has been made at sign in, that is prevented at sign out, I mean, timeout. So timeout is a
yes,
very, very crucial step before we actually incise the patient. And next is whether then the whole team will be asked whether there are any critical steps, so that the nurses, even if they
Yes.
have not understood the criticality or the anesthesia does not know, the surgeon tells very clearly these are the critical steps in this, so that all of us are prepared well in advance. And we are looking at even any blood loss, is there a
Yes.
huge blood loss? And as Dr. Vinay was pointing out, whether blood is reserved or not. Even at this juncture, if supposing blood was not reserved, we can always send a cross-match sample and reserve the blood. So these are very, very important things. Even the anesthesiologist is asked a question whether, everything is all right or any specific concerns for the patient. So he can also escalate. So these are very
Yes.
crucial steps. And at the same time, the confirmation from the nurse is taken whether the sterility of the instruments has been identified, and whether any x-rays or CT, MRI that is required for the surgery. So in between surgery, supposing suddenly an MRI is required, you don't run. So all these have to be present. So these are all definitely asked
Yes.
before we actually incise the patient. Now the most
Yes.
important tip now is here, and then antibiotic, of course. Antibiotic prophylaxis is very, very important to prevent surgery from getting infected. So this is
Infection.
again very,
Yes.
very important. So one of the few tips that I want to give to our nurses, because we have empowered in our hospital, we have empowered our nurses.
Yes.
I have had many meetings with the nurses, because this was a very critical step which we were not able to overcome for a long time. But now I'm very proud to say that my team
Yes.
has done an extremely good job, and we are achieving almost 95, 98% of compliance with the entire surgical
Compliance. Yeah.
safety checklist. So I think that's kudos to all the team members of
Kudos to
Yashoda,
all the team. Yes.
Yashoda, entire
Yes.
Yashoda group. And as Dr. Vinay was saying, that probably we are one of the safest hospitals. Yes, even I agree that, and I'm very proud
Yes.
to say that. So few of the tips I want to give is the surgeons are in a great hurry to operate. So even before the timeout is complete, they always want to take a knife and start cutting. So I have told my nurses, whatever it is, till the timeout is done, do not give a blade to the surgeon.
Yes.
The knife should never be given. I see many videos. So one of the ways we try to take compliance of this is we take videos of that particular surgery, a timeout procedure, and this is mandatory for all 100% of the cases. So this way, the surgeons are also have understood that the nurse will not give a knife. So they are also started complying, and they are participating in the timeout, which I
Yes.
think is a great
Yes.
achievement. And for all those hospitals and those nurses who are facing this problem, please follow this tip. Do not give the knife to the surgeon. Just 1 minute it takes. The timeout procedure, if done properly, just takes less than 1 minute, or
One
exactly
minute.
1 minute.
Yes.
So I don't think any surgeon cannot spare 1 minute for safety of the
Yes.
patient. I think it's
Yes.
very, very crucial and important to all of us understand this.
Yes, a very, very great insight you have told. At least it will help us in, taking forward this, paradigm. Yes. Now I could see Meme smiling when Dr. Vishnu sir was talking. Like now, Meme, the question we would like to understand from you: if at all your surgeon do not complying with the, timeout, would you tell your surgeon, stop, sir, let us do this call out for timeout? Would you say that, Meme?
Most of the time, what we face is it's very difficult to convince the surgeons to do timeout. So I agree with Dr. Vishnu sir. So that's why I was smiling. It is like sometimes what happened. Doctors are always interested, like they are very interested na. So we couldn't do the timeout in like proper way. We have to
Yes.
do like jaldi, and we do lots of mistake in between them. So that's
Yes.
why like I'm agree with sir. That's why.
So it's only
Yes. So
1 minute,
as
Meme. I
Vishnu
think
sir,
1 minute we have to ask them, sir, please, we
yes,
require only 1 minute
Yeah,
of
yeah.
yours. I
Yes
think we
sir.
have
Yes
yes,
to,
sir.
this is the empowerment that nurses in the OT have.
yes.
Just
Yes.
one
As
minute.
as Vishnu sir said rightly, he is there to support. It requires a lot of authority and empowerment. And at the same time, just say, consistent practice and vocalization, which may bore your surgeon, but the moment you say, sir, no, you should wait for 1 minute, and then
Yes,
only the knife is passed to you.
you're
you know
absolutely
I
right.
think, yeah, we also, one or two three times we say and we feel sad little bit, and then we hesitate, it is none of my job, how many times we should tell. This should not be the, culture or attitude. Let us do, boringly it will be predictable, but let us have this culture of safety. Yes, very nice it was about. Yes. And yeah, this, how should nurses perform a sign out, and what are common skip points? Jyoti, as you were saying, no, lot of skip points also we see, especially it is all about the, sign out format for the nurses. Yes, what are the skip points?
Yes, ma'am.
Few,
In sign
what
out
you say?
before patient leave the operation room, so sign out need to do, ma'am. And all the team
Yes,
members have let like nurse, anesthetists, and surgeons and technicians will be there, and they need to instruments, sponge, needles, everything to be counted, and specimen label should be main, ma'am. Main,
Yes.
whether we have
Yes.
done or not.
So as you were rightly saying that a timely documentation has to be happened, right? And there should be a call off, right?
Yes, ma'am.
Because all the
Sometimes
team
they will
member
do
here
verbally.
also.
Yes, ma'am.
Yes.
They will do verbally and they will not document it sometimes, ma'am.
Sometimes, yes, yes. So here also the three team members should be present here. Do you see your surgeon staying for the sign out time? Do you see? So that is how we are all discussing in general. We are not here, no offense on anybody, but we are here to just raise awareness that team members should stay back only for less than 30 seconds, Yes. And yeah, Shabnam, do you have to do you have to say something for this? Like, what is your setup? What is your practice at your setup? Yes, over to
Yes,
you.
exactly. I do believe that the sign out is one of the important step wanted to be followed by my students too, because they are bud nurses. So
Yes,
it is a critical checkpoint whether the to ensure the patient safety and even after the surgery and recovery. So I'm expecting the nurses, bud nurses has to follow this for a smooth
yes,
transitional care for the client in order to have a smooth recovery. And also, I believe if they are following a systematic sign out in the future, they can follow the same thing for their purposes. And I was listening to the members here, my co-speakers, how well they are no speaking out their experiences. So my children also can be the same way what my the co-speakers are talking all about.
of course, yes, yes. That is how gone are the days where students would just go into OT. They would just see how the surgery is performed, and
Yes,
then they just come out, read their records, fill in the numbers, and then go off and then sit and write in the exams.
yes,
Nowadays
exactly.
the nurses should be escorted, the superiors, and then they should see. Yes, going forward now, we are just nearing to the end of the discussions, and this is for Dr. Vinay's insight. What problems does this checklist addresses?
Def- uh,
Yes,
Definitely, it will improve. It will reduce the near miss.
yes,
Reduce.
The
yes,
main motto of him, emphasizing WHO surgical safety checklist is to reduce near misses.
yes,
So previously, when we didn't, you never used to follow this WHO safety checklist. We
yes,
had plenty of near misses. It doesn't mean that all our patients get into trouble, but when there are
yes,
so many near misses, at some point of time, you will land up in trouble, and your patient will also
yes,
land up in
yes,
trouble. So what
yes,
has this WHO checklist done? It has reduced even these near misses. It's
yes,
because we don't take any chance.
yes,
So the standard checks have ensured that errors do not happen at all. I won't say they're minimized. In many aspects, the errors have been like removed completely.
Zero.
yes, yes,
But there are certain issues where we need to make it 100% foolproof. And fortunately, we have a leader like Vishnu Reddy sir who has empowered us and who always acts like a driving force. So hopefully, we will make it 100% foolproof someday.
yes. So here I would like to even acknowledge the effort of our director, Dr. Pavan ji. Like yes, uh, like the brain behind his this concept when he
Yes,
was
Shanti,
dictating
you rightly
these.
said. See,
Yes,
one is, of course, I am driving the entire OTs, but primarily you should see that this has come from the board of directors also, because they are also
yes,
really
yes,
concerned about patient safety. It is not like safety is being implemented at the OT level only. It is coming right from the top. In the board of directors meetings also, we discuss about what kind of safety measures are being taken in the hospital. So, though we are
yes,
discussing about surgical safety for the operation theater, the same safety standards should be applied at every level where procedures are being done, like the cath lab, like the endoscopy suits, as well as the radiology where procedures are done. So, this is for all the nurses who are listening to this webinar. Please understand the safety is not meant only for surgical areas, but every procedure areas we have to be careful, including the wards where we identify a patient. If we miss the identification of a patient, we may send a wrong patient for some investigations like a CT or MR, which is not required. So these safety protocols have to be followed at every level.
So we also request all the nurses to just understand these terms like near miss, incidents, and further uneven, like untoward incidents is called sentinel events. Yes, we have just almost come to the last slide. Yes, and as you were saying, Vishnu sir, like yes, management support, manager, board of director support in terms of governance, leadership, and direction is required for this, critical complex, compliances. Yes. So you think that should all our nurses be empowered for checklist compliance and own patient safety? Yes, few points and then we end the session.
Absolutely. Every nurse, and as Dr. Vinay was telling, everybody in the theater are empowered for doing with this checklist. So, we
Yes.
have, as Ms. Shanti Bhattacharya was telling about Jyoti and Meme, who are there to, monitor the OR compliance, patient safety
Yes.
compliance in the operation theaters. They are not able to do everything. Like we do 100 surgeries in a day in a theater complex. So obviously one nurse cannot see everywhere whether it's happening or not. So because of that, we said every person in the operating room is responsible for the patient safety. So
Yes.
we ensure that each and every person is empowered. The operation theater nurses or nurses are 100% empowered. In fact, we take accountability from the nurses saying, in your operation theater, if this has happened, it's not checked, then you are responsible. And we have empowered them. As I told you, they are empowered not to give a knife to the surgeon till the timeout is done. So, we are there to back them 100%. Absolutely no ways, no two ways about the fact that if a surgical safety checklist, any component is missing, be it sign in, timeout, or sign out, all three, we are going to be there backing our team.
So yeah, this subject cannot be just wind up within 20 or 30 minutes of
I
time.
know, I
And
do understand.
yes, I think we had a few crisp discussions, and furthermore, we like to continue it in a series of form and way. Yes, and I thank Vishnu sir, Dr. Vinay, Meme, Jyoti, Shabnam from Bangalore, and Aditi. Yes, please kindly share, and yes, a word of note from Dr. Vinay to all the viewers, and then we end.
Thank you so much, ma'am, for inviting me. Thank you, team. That was a great session.
Thank you. It was my privilege that I was could drive the session. Yes, and yes, thank you so much. We end the
Thank you.
session.
Thank you,
Thank you.
everybody.
Thank
Thank
you
you so
so
much.
much,
And
ma'am.
I'm
Thank you so
sure
much.
this session is going to make a lot of difference and make more and more patients across the world safe. I think that is
Yes.
our motto.
Thank you, sir.
Thank you, sir.
Thank you.
Nandiji, can we wind off?
Thank you so much, ma'am.